and the panel is going to ask, is going to talk us through those questions like strengths and weaknesses, and those kinds of questions. So one of the questions that you might get is, tell us about a time you had a conflict with a colleague and how did you resolve it? So we know now that that is a behavioral-based question. Keith, what's the best way to answer that question specifically? Keith?
Which question, Tanya? I'm sorry.
The one, tell us about a time you had a conflict with a colleague and how did you resolve it?
Right. People have a hard time talking about this particular topic because conflict is something we like to avoid generally as human. So you have to think back on a time when there was some sort of disagreement or some sort of conflict where you needed to come to some type of positive resolution. And it doesn't have to be a conflict where you're yelling and screaming at each other. Hopefully it was not. It just has to be an area of disagreement. And that's what we often mean by conflict. So a physician was making an order and you agreed with the order. And that might not be something that doctors where a nurse would question a doctor, but here in the United States, it's quite common for a nurse to say, doctor, that that order, I'm questioning why you're ordering that particular medication, or I think that dose might be incorrect. So that's very common here, and it's expected of a nurse to actually be able to go to a physician and question an order, because you'll be held responsible if you use the wrong medication or the wrong dose. So it really goes back to that, the STAR method in a sense, where you have the situation at hand and then the action you took in of speaking with the doctor, for instance, and how you actually approached that person with the issue at hand and how it was resolved. What was the resolution? What was the conclusion of that situation? So this is a very difficult one to be prepared. Here in the United States, I would say that it's a very common interview question, and you need to have a couple of scenarios so that you can respond to it and show how you communicate. And one thing I want to add, Tanya, that any question that's asked in an interview, I always tell my career coaching clients, I always say, think about what they're asking and why are they asking me this question? What do they truly want to know of me? So when they're asking a behavioral type question, think in the back of your mind, what does this person really want to know? What are they after? And try to answer the question in relation to that. That'd be very helpful.
Yeah, that's a great tip, Keith. Because often when you are, just talking about like that question about the doctor, for many international nurses, they come from cultures where the doctor's not to be questioned. And it can be quite difficult for nurses to ask that question. But at the end of the day, the employer is really just looking to see if you are able to handle conflict and resolve it in a positive way.